Introduction to RSV. RSV is a highly contagious respiratory illness. It is spread through direct contact or through the air on infected respiratory droplets, especially when someone touches a contaminated surface and then proceeds to touch their face, such as their eyes, nose, or mouth. It can survive on hard surfaces for many hours, contributing to its high infection level. Dr. Morris Hillman discovered the virus in 1956 in a chimpanzee. A year later, in 1957, it was found that RSV also caused respiratory illness in humans. RSV infects the ciliated cells in the upper and lower respiratory tract, predominantly seen in the bronchioles. This infection causes inflammation, tissue damage, and excessive mucus production. RSV was first discovered in humans through the case of a child contracting a severe respiratory infection through RSV. RSV is a single-stranded RNA virus that causes cells to fuse in the respiratory tract, known as syncytia, hence the name respiratory syncytial virus. The causative agents and symptoms. So RSV is a causative agent of respiratory infections, especially in young children and in the elderly. It also can have severe impacts on someone with a compromised immune system who is more susceptible to viruses. Gram staining is used for bacterial classification. Therefore, this does not apply. RSV is a virus. The morphology is spherical or filamentous. It contains glycoproteins, which are essential for it to thrive and remain pathogenic. It appears spherical and elongated, surrounded by a lipid bilayer. This is seen through electron microscopy since RSV is not visible through the process of Gram staining. RSV's virulence is primarily due to glycoproteins. This allows the virus to essentially fuse with the host cell membranes, providing easy access to infect respiratory epithelial cells. In addition, RSV does not provide long-lasting antibodies if you have contracted the virus in the past. Individuals can be reinfected often during their lives, which makes the virus dangerous, especially given the possible severe side effects. First signs of this virus are sneezing, fever, cough, runny nose, and decrease in appetite. Infants may become irritable, fatigued, and have difficulty breathing as well. These symptoms do not occur all at once. They usually occur in steps and worsen over time. RSV is contracted through infected droplets in the air when an infected person sneezes or coughs. It can also be spread through dried respiratory droplets on hard surfaces. So, the prognosis of RSV. RSV usually resolves within 1 to 2 weeks unless complications develop. This infection can cause tissue damage, making symptoms linger well after the primary infection has passed. This virus can significantly raise the chances of secondary bacterial infections as well as heart disease or possible chronic lung conditions. Ultimately, it can cause damage to the lungs, heart, and airways. The current and future scientific research for this, the FDA has recently approved 2 RSV vaccines specialized to help varying populations. These new vaccines will drastically reduce the number of RSV cases. This new search will have a significant impact on many people, especially those who have suffered from sicknesses, as well as those wanting to prevent their young children from contracting this virus. The vaccines include Arexvy, which was approved in May 2023 for adults 60 years and older, Abrezvo, which was approved in August 2023 for adults 60 years and older, and now including pregnant women at 32 to 36 weeks gestational age to prevent RSV in infants from birth up to the first 6 months of age. And Mrezvia, which is expected to be available in the US by 2024-2025 RSV season, meaning sometime in December and January, mostly the winter months. So, diagnosis and treatment for this is RSV is contracted, like we said previously, through infected droplets in the air when an infected person sneezes or coughs. It can also be spread, though, through dried respiratory droplets on hard surfaces. Types of RSV testing include RSV antigen testing, which is most common and available within an hour. RSV RT-PCR, which is a molecular test that detects genetic material of the virus and is more sensitive than antigen testing. Viral cultures are used to grow the virus over time. Influenza and group A strep tests may also be ordered to rule out those pathogens since they have many similar symptoms to RSV. There is a vaccine which is given mainly to children, pregnant women, and the elderly, providing immediate protection and relief for at least 5 months. In addition to the vaccine, medical treatments include over the counter medications to help reduce fever and pain, nasal saline drops, and staying very hydrated. For more serious infections, the patient may need IV fluids or antibiotics if a secondary infection has occurred due to the illness, or supplemental oxygen due to the drastic effects on the lungs that it has. It is very important to maintain an electrolyte balance and stay hydrated during the infection of this virus. Watch carefully for signs of dehydration. Clean anything that is touched while sick regularly to help prevent further spreading of the sickness. Incidence of RSV. RSV normally peaks between December and January in the South, the Southeastern, and Mid-Atlantic United States. Primarily affects young infants and the elderly. Children at the age of 2 are likely to have contracted RSV at least once, and RSV is more prevalent in Black and Hispanic communities.